Headaches vary widely in their intensity and in the seriousness of the underlying conditions that cause them. Therefore, effective diagnosis and treatment is essential to prevent serious conditions. Firstly, you should know that headache is throbbing, sharp pain, or pressure in the head or neck, sometimes accompanied by nausea, neck aches, and muscle pain. Secondly, you should be aware of all such aggravating factors which makes headache worse, including head injury, anxiety, alcohol, certain foods, pressure over points in the face, placing the head between the legs. Well, the vast majority of headaches are due to muscle tension, fever, or infection. The brain itself cannot feel pain. The pain comes from stimulation of blood vessels, muscles, or nerves in the head and neck. Now there are some important questions that you need to ask your patient before making a diagnosis. You will ask the patient what symptoms they are experiencing, including history of unconsciousness, change in memory, motor or sensory change, nausea, vomiting, stiff neck, fever, ear pain, eye pain, change in vision, nasal discharge or stuffy nose, muscle aches or pains, anxiety, depression, seeing flashing lights or having funny feelings before the headache, results of previous skull X-rays, CT, or MRI. You will ask your patient if they or anyone in their family have had any of these conditions: nervous system disease, previous skull fracture, migraine headaches, cluster headaches, emotional problems, sinus disease. You will ask the patient if their headache wakes them up from sleep, if it occurs more often at night, if it began suddenly, or if it recurs. You will ask the patient if they are taking any medications including aspirin, codeine, ergot, caffeine, steroids, oral contraceptives, sedatives, decongestants, any injections. You will ask the patient where in their head they feel pain and what the pain feels like. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes blood pressure, temperature, thorough eye exam and ear exam, checking sinuses for tenderness, looking for discharge from the nose, checking the throat, examining the neck for stiffness, thorough examination of reflexes and movement, a series of exercises to reproduce the pain. Now, what can cause headache, and what is typical for each cause? Well, there are different causes of headache that you should be clear about. Firstly, we will discuss common causes of headache. If the patient shows symptoms like constant band-like pressure that lasts days to weeks, pain often centers at the back of the head and worsens at the end of the day, triggered or worsened by anxiety, then this might give you an indication that the patient has muscle tension. Well, muscle tension is defined as tightness in the muscles of the shoulders, scalp, neck, and jaw. But if your patient has typical symptoms like throbbing pain that can last several days, often experience typical funny feelings before pain kicks in, headache often centers in the front of the head, often preceded by nausea and vomiting, family history of migraine, may be caused by alcohol or stress, then this might be an indication to classic migraine, which is a severe form of headache. And what if your patient is having resembles classic migraine, often appears without typical funny feeling beforehand? Then these symptoms might be caused by common migraine, which is in fact a severe form of headache. And if patient has symptoms like brief pain centered in the front of the head, occurs often at night, tearing, nasal stuffiness, sometimes go for months with no symptoms, then cluster headache might be a reason to this. Well, this is characterized by recurring form of headache. Now, if the patient has facial pain, nasal stuffiness and discharge, pain increases when head lowered between the legs, fever, then this might give you an indication that patient has sinus headache. Well, sinus headache is headache caused by sinus inflammation. Now, if the patient shows symptoms like fever, muscle aches and pains, cough, sore throat, then this might give you an indication that patient has febrile headache. Well, this is headache caused by fever. Now, if the patient is having pain in the neck and the back of the head, sometimes pain worsens with neck movement, more common in people older than 40, then this might give you an indication that patient has cervical arthritis. Well, it is arthritis in the vertebrae of the neck. Now, if the patient shows symptoms like jabs of pain, pain often occurs near the eye, may be brought on by cold, heat, or pressure over the triggered area, then this might give you an indication that patient has tic douloureux. Well, tic douloureux is a diseased nerve problem causing facial pain and spasms in facial muscles. Now we will discuss rare causes of headache. What if your patient is having fever, nausea, vomiting, and stiff neck? Then, these symptoms might be caused by meningitis, which is in fact infection or inflammation of the covering of the brain. Now, if patient has sudden headache, change in consciousness or neurologic function, vomiting, and stiff neck, then these symptoms might be caused by subarachnoid bleeding, which is in fact bleeding in the brain. But if patient has pain in the base of the skull, chronic muscle aches and weakness, vision loss, more common in people older than 40 who have never before experienced headaches, then these symptoms might be caused by temporal arteritis, which is in fact inflammation in the blood vessels of the brain. Now, if patient has blurry vision with a history of high blood pressure, then these symptoms might be caused by hypertensive crisis, which is a state of severe increase in blood pressure. But if your patient had a recent headache that does not resemble other conditions, then these symptoms might be caused by brain mass, which is the presence of a tumor or collection of pus, immune cells, or other material in the brain. And lastly, if the patient has headache and consciousness waxes and wanes over months, more common in the elderly, alcoholics, and people who have experienced head injury, then this might be an indication that patient has subdural hematoma, which is defined as blood clot in the brain. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of headache. To watch more such videos, do visit the DDX section, only on sqadia.com.